Hi, I'm Eski, brand ambassador of Women Disciplines magazine. We are at the Westin City Center, Bahrain. I will be hosting you WTM Wellness Podcast, brought to you by Alchem Wellness and Medical Center.
The number one mistake that people make when it comes to brain fog is ignoring their nutrition. If you're struggling to focus, meet deadlines, and also tend to forget things, it is not just you. It's your brain saying that it needs some nutrients. Our IV therapy delivers hydration and nutrients to support your mental clarity. Book a free IV therapy consultation today here with us and say goodbye to brain fog.
Dr. Paulo, welcome to WTM Wellness Podcast.
Thank you for being here. It's a pleasure. I'm from Brazil, first of all, but I'm here in Bahrain since 2018. I'm a plastic surgeon, a consultant plastic surgeon, and I work with cosmetic surgery.
What makes you passionate about this work?
So, first of all, the challenge. You know, plastic surgery is something that can change a life. Not even if we are talking about a reconstructive surgery, for example, a breast reconstructive surgery, but also when we are dealing with aesthetics. Some patients, they are worried about how they look, or they have some problem with the self-esteem. So the good thing is when we can change their lives, you know what I mean? Because we can improve their self-esteem, their life passion back.
Usually when we think of plastic surgery, we don't see the perspective from self-esteem development. So what do you think is the most misconception we have?
Important misconception is this one. We are not only aesthetical surgeons. The good surgeon, he needs to understand about everything, not only about technique, but about patient self-esteem. You know, so we are dealing with people. We are not dealing with some machines or whatever. So we need to understand their wishes. We need to understand their background. And with this, we can do the best for them. It's not our job to point problems. It's to understand what the patient doesn't like, or why the patient is suffering. So with this, we can create a plan to bring the best that the patient already had. We can show to the other people what the beauty that the patient had. We will not create beauty. We will bring back the beauty inside.
That's amazing. Speaking of the best, I was recently invited to be as part of your welcoming ceremony. Please tell me how it feels.
Alchem is already one of the best clinics here in Bahrain. Alchem built one very good reputation when we are talking about health, wellness, and integrated medicine. And I'm here to add a little bit more value to the clinic, because we can integrate the wellness and the beauty in the aesthetic parts, because we have to understand the patient as one thing. You know, it's not only about beauty, but it's about health. So we should treat the patient from outside to inside, yes, but also inside to outside. So with me there, I think we can create more tailored treatments that can bring to the patients the best. So Alchem is already ready when we are talking about improve the patient's health. And I'm here to add a little bit more.
Okay, I'm looking forward to that. Alchem is also bringing new attention to the kingdom. They are promoting the medical tourism as well. But we also hear people traveling abroad because of this medical tourism. What do you have to say about that?
We have to be really careful. I think medical tourism is an important part for the patient, because sometimes the patient doesn't have the best in their country. But if we have the best in our country, why we need to travel abroad? Some people, they go abroad looking for some treatment because maybe it's cheaper, but actually sometimes it's not cheaper, as there are so many things that we have to add in the final cost. So for example, flight tickets, hotel, and also if you are in your hometown, of course it's much better because the doctor can follow you closer, can treat you like as a human being, not as someone that goes there to do the surgery and then come back. I'm free of you, you know. So here, when you are in your hometown, you have your family with you also. So it's much easier to have a good journey during the whole process.
So in case there is any complication, it's better to be where you live?
Yes, we have to understand that any medical procedure or even any medicine, it's not totally free of risk or side effect.
Yes.
So unfortunately, we have to be prepared for that. And if you do the surgery abroad, who will take care of you? Because it's very complicated to get a patient that we don't know what was done there, which technique the doctor used there, you know, how they approach the problem. And even because we don't know the patient before, medical conditions. So it's really, really, really difficult to treat one patient without knowing the full medical history, not only the past medical history, what was done during the surgery, you know. So this is important. So yeah,
it's interesting to know. But how do you approach patients' expectation from the reality? Because in this social media era, everybody wants to look like the other, especially influenced by celebrities or any people we know around us. When do you say, when is it enough? And how do you meet the expectation?
Nowadays, we have to understand the social medias as the most accessible media. It's not anymore the TV, for example. All of them, they are looking for influencer, not as before TV actors and actors, you know. Unfortunately, we are seeing the social media some mistakes. The influencers, they are looking for likes or engagement, and with this, they are sometimes showing something not real. And as the aesthetic field, it's a very profitable area. Some of doctors or influencers, they are looking more for likes and money than for the patient's health. You know, so we have to be careful with what we see in the internet, because sometimes there is some manipulation, digital manipulation, filters, or even sometimes not the same patient that we can see in the before and after. If you see in my Instagram, I don't post too much before and after because I believe that each patient is unique. We cannot compare patients with each others. But of course, I have to explain them.
Yes.
And I have to bring them to the reality, to show them what I can do according with what they want. We create now, of course, based in studies, based in evidence, because the most important part in medicine is to have a medicine based in science. Okay, so we create one protocol that we can use the IV therapy as a preparation for the surgery, I mean, before the surgery and after the surgery, to bring a very smooth, comfortable, and good journey after the surgery. So that's why it's so important to be involved with our team, that they already have a very, as I said before, a very good reputation in IV therapy. So that's why we tailored one good protocol for before and after surgery.
I want to know about tummy tuck. I heard it's the most difficult surgery, and I also want to know what is the downtime after the surgery.
Great, this is a good question. Actually, tummy tuck, it's one of the most common surgery in this area. The good thing about tummy tuck, it's because we do 3 surgeries in one. I will start doing a liposuction. So with the liposuction, we can remove this stillborn fat. The second one, we will remove the extra skin. So of course, the patient can have some extra skin after, for example, pregnancies or lose weight, you know. And the third thing, that is the most important thing, we can fix the muscle. Because we have a muscle called rectus abdominal muscle, that after pregnancies or after the patient gain weight, that it can happen one separation. We call it divarication. There is a gap between the muscle, and we can fix this one, bringing the muscles together. You know, so we are talking about 3 surgeries in one. it's difficult, technically speaking, yes, because we need to respect the surgery and we need to respect the patient. So we cannot say that it's something silly
Easy, yes.
and easy. Okay, we need to respect. All the surgery has benefits and risks. So, but when we follow the right protocol, we reduce a lot of this risk. So the patient needs to be prepared before the surgery to have all the blood tests done and okay. The doctor needs to know what to do, and the patient needs to follow the doctor's instructions to achieve a good result. So that's why it depends how we do this one to have the downtime. Each doctor has his own protocol. In my opinion, so the patient needs to wear a garment that will help to reduce swelling. It will reduce the pain.
How long?
For at least 6 weeks, 45
weeks.
days. Yes,
Okay.
24/7. Just remove to take shower and to wash. Then slowly, they can start to work out, like first walking, and then they increase the strength of the exercise slowly. And then after 2 months, patient can do whatever she wants.
Okay.
I used to say that the final result we will see after 4 to 6 months. But of course, after 1 month and a half, 2 months, we can have a very good idea how it will look.
So will the final result matters depending to the patient?
Depends to the patient.
Okay.
Depends how long is the surgery,
Okay.
how difficult is the surgery,
Okay.
and about what the patient does after the procedure. There are some things that we can speed up the recovery.
Okay.
Of course, that's why we have the IV protocol
I see.
to speed up the recovery, and the patient needs to follow the rules.
In average, how many kilo do you think the patient, I know it varies patient to patient, but in average, do you think the patient will be losing a lot of weight?